Hey, Dr. C here with you. What's up with reverse T3? Is yours high? What should you do about it? What's the significance of it? This is it. This is the definitive, complete, comprehensive, exhaustive, thorough, covers all bases guide. No more questions asked past this one. This is just like everything. I wanted to get it out because it's an important topic. And I've talked about it individually and at events or whatnot, but I've never written about it in the detail that it deserves. And I got a question from a dear woman named Linda from Australia, and it pushed me over the edge to want to be thorough about this and cover all the bases. And it's important stuff because there's real problems that are lurking behind high levels of reverse T3 that we don't want to miss because your health won't be at its best until they're resolved. But the other side of it is that there are a lot of unsafe therapies that often are recommended on the tail end of reverse T3 testing. So here we go. Why is it high? Should I test it? Is it making me sick? What's the best way to manage it? So the quick overview is that it's only high for a couple of reasons. And there's possible reasons and there's most common reasons that apply to those who are actually tested because it's not routinely tested. And the latter scenario, those who get tested for reverse T3, when it is high, it's almost always because they're taking too much thyroid medicine. Let me back up and go a little deeper in that. So those who do test for reverse T3 often are of a mindset that it can be a cause of symptoms. It can block the activity of thyroid hormones. And a lot of the beliefs that go along with that include ideas that you can ignore blood tests saying that someone is getting too much thyroid and that you can give more thyroid based upon symptoms. So the most typical scenario is someone is working with a practitioner who carries those beliefs and they're on some treatment. Maybe the treatment worked for a while and the doctor's first step is often to raise a dose of thyroid medicine. This could be a compounded T4, T3, this could be natural desiccated thyroid, this could be just T4 even, but the doctor will, and the last one is probably the least common, but the doctor will step up the dose a couple of times trying to help someone feel better. And if it's not working, that's often when they're going to check reverse T3. And it's high, it's through the roof. So the most common scenario is that reverse T3 is high because someone's just taking too much thyroid. Now, this could happen just as much from someone who is making too much thyroid, meaning their gland is overactive. Most common scenario for that is Graves' disease. However, as it plays out, I don't see many doctors use reverse T3 as a first line test for hyperthyroid symptoms. So that's possible, it's just not quite as common. Now the other scenario is a thing called non-thyroidal illness syndrome, and that's a situation in which your body is sick in some way that does not relate to your thyroid, but your thyroid gland is compensating because of it, thus the non-thyroidal illness syndrome, name for it. This has also been called euthyroid sick syndrome or low T3 syndrome. And most commonly, this will present with normal levels of TSH, normal levels of T4, they could be a little low, a little high, or normal. T3 is generally low, normal, or low, and then in some cases, reverse T3 is elevated. Those are classic findings. So when reverse T3 is up, and TSH is normal to low normal, what that's saying is that the body's compensating. So this is known about a lot to occur in intensive care units. Say someone has late stage kidney disease or congestive heart failure. It's commonly expected they will have this thyroid pattern. And for a lot of time there's been debates as to whether it would help to treat them for being hypothyroid, because some of their thyroid markers look like they're low, others don't, and so would it help them to treat? And the consensus is that it probably does not. There were some times in cases of congestive heart failure to where it was thought that there may be benefit to treatment, but as of this time, the consensus of data is that there is not. So we think that it's either just a random thing the body does, it may be a protective mechanism, it may be a random response to inflammation, but in either case, it doesn't help to give more thyroid hormone to compensate for the fact that there may be less T3 and higher amounts of reverse T3. So that's non-thyroidal illness syndrome. That does also occur in less severe non-hospitalized situations, but it's best documented in inpatient care. Uh, the other scenario is that it's just randomly high and it means nothing. So we don't have strong reference ranges for where reverse T3 should be in healthy populations. There's different units of reverse T3. A lot of medications can disrupt it, including contraceptives. There's a lot of ways by which people can have just random levels that change that are not related to them being sick or causing symptoms at all. So it can be from too much thyroid, from non-thyroidal illness syndrome, or from nothing. It can be just a quirk. You know, there's many things that have had a lot of data points around them, like your blood sugar, and there's no one that has high blood sugar with no relevance. That's always important. But reverse T3 can be of no relevance. So that's another scenario. Again, by far the most common situation I see clinically, because I don't order reverse T3 tests. I don't have that run that on people. And as you listen to this and look at the blog, if you wish to, you'll understand why. But if someone has it done, they've had it ordered by another doctor, and in most cases, the beliefs that include the recommendation of checking reverse T3 also include giving high-dose thyroid medicine. So people are pretty much just getting too much. And here's a big paradox, and stay with me for this. This is super important. A lot of doctors don't get this. When you're getting too much thyroid, you can feel like you're getting too little thyroid. It's not intuitive, but it's completely true. So when there's too much thyroid hormone coming into your body, your system works really hard to get rid of the extra thyroid hormone. And when you do that, you can block the effects of thyroid hormone from crossing cell membranes and being used by your mitochondria and by your other organelles. So you can make your body thyroid resistant by having too much thyroid. And paradoxically, you can have symptoms of fatigue or easy weight gain or hair loss or muscle pain. You can feel just like you're getting too little from getting too much. And the other wrinkle about this is that if in a situation like that you were to raise the dose, you'd probably feel better for a while. You know, maybe a few weeks, a few months at the most, but then the symptoms come back again. And what's taken place is that it took a while for your body to get caught up with digging in its heels that much deeper. You know, your body is fighting this extra thyroid, and if there's a lot extra, there's a point at where it cannot fight it. And there, that doesn't mean that you feel good all the time. It means that you gradually lapse into more obvious hyperthyroid symptoms, which can still include fatigue, but can also include anxiety, panic, tremors, sweating, racing heart. It often gets more obvious past some threshold. But before that, the cycle is people often feel great when the dose is stepped up, and then it kind of drifts, and they feel hypothyroid again. And it's your body fighting off too much. And the lab pattern for that can include low T3. So what typically happens is the TSH gets lower because the brain is saying there's too much thyroid hormone. And if your body can keep up with it, it will try to bail out T3. And you might have low T3 levels on a blood test. And I completely understand why someone could look at that at a superficial level and think, oh wow, this person's tired, their T3 is low, let's give them more T3. It seems so logical, but it's exactly the opposite of what your body is trying to achieve. So those are the main ways that give rise to high reverse T3. I'll talk a bit more about some of the outpatient causes of non-thyroidal illness syndrome, but a little more about just some of the backstory for those who are interested in this stuff. So reverse T3, your thyroid hormones are built from a protein called tyrosine, an amino acid called tyrosine. That's converted into thyroglobulin, and then thyroglobulin is fused with iodine atoms. An enzyme called thyroid peroxidase helps that connection take place, make that love connection with iodine and thyroglobulin. So you've got two sets of thyroglobulin, each with two iodine atoms, so 4 iodine atoms altogether. That's T4. It's also called thyroxine. Take that same setup, strip off an iodine, you've now got T3. But strip off that iodine, now you've got reverse T3. So they're the same thing. It's the same Legos. Imagine that you've got like 4 fingers and a thumb, right? So this is also 4 fingers and a thumb, but it's a reverse image. They're identical, but you can't superimpose them. And try putting your right hand in a left-hand glove, and you'll see that there's a difference. And it's the same thing. This is called stereoisometry in chemistry. In many cases, when you make a molecule, you'll get 2 versions of that molecule, one that is a mirror image of the other. And in biology and in biochemistry, there's many examples to where one is active and one is inactive. Sometimes the inactive one can be toxic, sometimes it can block things, other times it just does nothing. And in many cases it does the same thing, it can have the same chemistry. This is a case to where the mirror image is just inactive. It doesn't block, it doesn't hurt, it doesn't do anything bad, it just doesn't do anything. It's the key that doesn't fit. It's not the key that plugs up the lock, it's just the key that doesn't fit. So that's the basic chemistry of reverse T3. And from reverse T3, we make T2. And T2 is an active thyroid hormone. It is one that governs metabolism, it affects ovarian health, it has effects upon basal metabolic rate, it affects liver function, so it is important. And the main way we make T2 is by breaking down reverse T3. And reverse T3 is what we make most of our T4 out of. We make more of it into reverse T3 than we make into T3. So it's there. It's stuff that's sitting around. Our bodies have quite a bit of it. Now, in the alternative world, there's this idea that reverse T3 is a bad guy and that we must block it or fight it. And this comes down to a confusion of cause and effect. An analogy, if you would bear with me, that I've used for this is umbrellas and rain. So you could imagine a group of aliens visiting Earth, and if they had just like no clue about Earth culture or basic things, they could fly over Seattle, and they could fly over a park in Seattle, and they could mistakenly think that umbrellas caused rain. You know, whenever they were over an outdoor area with lots of people and it was raining, they would see umbrellas. And maybe not everyone, but they would see a lot of umbrellas. So you could think, wow, when those people take their umbrellas out, that's when it seems to start raining. So the umbrellas must trigger that. So to further this analogy, these aliens could make a hypothesis that if they wanted to prevent rain in one neighborhood of Seattle, they could go around and confiscate the umbrellas. And that would make it so where it couldn't rain. And it's laughable, right? Because that's an obvious conflation of cause and effect. But that's what's happening here with reverse T3. So doctors see situations in which reverse T3 is high, and they think, oh wow, this person's tired, or they have inflammation, or they have chronic pain, or whatever other concern, and there's high reverse T3. So therefore reverse T3 is the culprit. And then they take steps to basically confiscate umbrellas to stop the rain. So we only make reverse T3 out of T4. And therefore, if you stop the body from making T4 and you take away all sources of T4, you can stop the formation of reverse T3. You can lower it. Now, that's commonly done by giving really high dose T3. And here's how that plays out. If you give enough T3 and no T4, well, there's no T4 coming in, right? But if you give so much of that, the TSH gets pushed down and the brain is no longer telling the thyroid to work. That means your thyroid is not making T4. You're not making any, you're not ingesting any. Now you've got nothing to make into reverse T3. So yes, you can starve the equation for reverse T3. You can take away all the umbrellas. But if the clouds are up in the sky, it's still going to rain. So whatever gave rise to that person's reverse T3, that's why they weren't feeling well. That was the cause of their symptoms. And you know, maybe that cause went away by itself, or maybe it was a small thing that wasn't too significant. But if it's still there, if it's not addressed, they will not feel better. And if they're now also hyperthyroid, there is a chance they could have a non-specific stimulant effect. T3 is a stimulant. And I've heard people say, you know, but this must be what I need because I only have energy when I'm taking a high dose of T3. And you know, the logic there, we could say the same thing about methamphetamine or cocaine or crystal meth. You know, someone who legitimately is tired, their body's not working right, they'd probably be, I don't know, given a little bit of a boost for a while if they took enough stimulants, right? But that doesn't mean that they're healthier from it. That doesn't mean you solve the problem. That just means they were stimulated for a while. And we know that on the tail end of that, the crash is going to be even deeper. So thyroid hormones can be no different. So even if it seems like you only have energy from that, it doesn't mean that's what you needed to bring you closer to long-term lasting good health. So that's the basic thought process behind that. And these ideas came about from a couple of doctors, mostly Dr. Dennis Wilson, but his work was foundational upon, or built upon, that of Dr. Broda Barnes. Broda Barnes argued that thyroid disease could only be accurately diagnosed by basal body temperature. And to his credit, during the bulk of his career, the blood tests for thyroid disease weren't great. They had a really high rate of false negative. So he had cause to be suspicious of them and cause to be wary of them. And his wariness and suspicion carried forward past his career. But towards the end of his career, the blood tests got better. And they're still not perfect, and the ranges are too broad, but they're much better than basal body temperature. Barnes argued that normal body temperature was very narrow, 97.8, 98.4, that if you were outside this narrow range, you were sick. And we now know that most healthy people are just never in that range. That's just a very narrow range. A lot of healthy people have lower or higher body temperatures, and it's not a problem. We also know that many things beside the thyroid have a large impact upon the basal body temperature. Of course, a woman's menstrual status can cause it to change greatly, and many other factors as well. So Barnes set the threshold that body temperature was what mattered for thyroid disease. Wilson took that and embraced that idea directly, but he argued that blood tests could diagnose hypothyroidism. And to look back through things historically, his practice started at a point where blood tests were better than they were for when Barnes' practice started. So he argued that blood tests could diagnose hypothyroidism, but the temperature could diagnose another problem. And he argued that if you had any of a long list of symptoms and you did not have obvious blood levels of hypothyroidism, then the problem was your body was making too much reverse T3. And it gets a little tricky because he argues that this happens inside the cells, we can't measure it, but we know it's happening, and I'm not sure how we know it's happening if we have no way of knowing that it's happening, of measuring it, of documenting it, but oh well. He argues that the body temperature is only affected by that, and that anything outside of these small ranges means there's a problem with reverse T3. Now, how I mentioned before about non-thyroidal illness syndrome, how the body makes a lot of reverse T3 when it's sick, we know that happens. But we also know that when you're not sick, you stop doing it. When the cause goes away, the condition reverses itself. And Wilson argues that for some people, that it gets stuck, that even after the problem has gone, the high amount of reverse T3 somehow blocks the body from making any more normal T3. And it's a very specific claim. It's a very measurable claim. We can assay and see how these enzymes work. And this actually has been looked at in pretty good detail. It's fascinating to me to see how many studies in the 70s and 80s were done on these topics. And they would do things like give people megadose reverse T3. I had no idea, but there was pills and IV forms of reverse T3 that a lot of people had a lot of doses of. Some were healthy, some were obese, some were sick, but they would see how these megadoses of reverse T3 would act on their conversion of T4 to T3. And if Wilson's theory was correct, there should have been a point at which giving someone a lot of reverse T3 would change how they worked in converting their thyroid hormones. And it just didn't. It was tested. It was tested often in many ways from many directions in humans and animals and test tubes. It just doesn't work that way. So when high reverse T3 is there, it's an umbrella secondary to the rain. It's not causing the rain. It's an umbrella. The rain's causing the umbrella. The umbrella is not causing the rain. So the priority, the task priority with high reverse T3 is figure out why it's raining. Maybe that's not a good one because we know why it rains. We can't always control that, but figure out why the body is not feeling well. Wilson's model argues that if you take a high enough dose of T3 by itself and you time that properly, you step it up and you step it down, you will basically push enough logs in to break through the log jam and things will be fine again afterward. And just no evidence to support that, and a lot of reasons to think why that's a harmful thing. So high-dose T3 is, quite frankly, dangerous. There are documented deaths from people following Wilson's protocol, including those under Dr. Wilson himself. And there are a long list of side effects. I've seen patients have major complications from these protocols, including very early cardiac damage, strokes, bone thinning, hip fracture. I've seen this stuff. It's real. And you think this through. If someone is metabolically compromised, they've got some chronic inflammatory thing occurring in their body, they're even more apt to have side effects from a new stressor, from being dosed with a stimulant essentially. So high-dose T3 has dangers to anyone, but if someone has a lot of reverse T3 in their system, well, they're more vulnerable. They've got an unexplained problem. So that's the last person you want to push over the edge with a mega dose of stimulants. So I'll leave a lot of the rest of my rants for the blog. I talked in just excruciating detail about all of the core claims behind Barnes and Wilson and the body temperature, all the studies, all the citations. I went through them and I read them all. And I didn't just read the citations they gave, but I read the citations that the citations used. And when I was all done with it, well, I had sacrificed some of my time I'll never get back, but I saw no data corroborating their ideas. If I did, I'd be happy to be sitting here telling you a very different story, but I didn't. And I've got to tell you the truth, and I've got to tell you what's going to bring you back to better health. It would be really fun to say, here's this way in which the thyroid works that most people are clueless about, but me and a few insiders know about, and there's a solution that only a few of us who prescribe T3 in this way can help you with, and it seems really exciting, and that would be easy to incentivize that, but it's just not what the data supports. So I'm going to move past this in my notes and talk a bit more about just the typical scenarios and some things to look for. So what are the main things that would really cause someone to have reverse T3 high, assuming they're not just taking too much, and assuming it's some version of non-thyroidal illness syndrome, and assuming that they're not hospitalized? Well, here's some ideas behind that. So someone who's not hospitalized, we'd think about there being some well-documented factors behind this. The biggest one by far is fasting or prolonged caloric restriction, and specifically protein malnutrition, and believe it or not, carbohydrate malnutrition has been shown to be a big driver in this. Any of those things, what happens is that your body attempts to slow its basal metabolic rate, and the way you do this in a large extent is by deactivating a lot of your thyroid hormones. So your thyroid puts out T4 and your system says, hey, I'm not getting a whole lot of fuel. I can't drive that far, So your body takes that T4, makes more of that into reverse T3. That slows the basal metabolic rate. So total food malnutrition, fasting, protein calorie malnutrition, or low carbohydrate and ketogenic diets are all things that drive high reverse T3 formation. So if those have been part of your history, they can do that too. And the trick there is just to not be on a restrictive diet in terms of your food type, your food quantity. I argue in the metabolism reset diet that if your waist size, if your energy, if there's struggles, it's okay to treat that in the short term and resolve it, but then eat well, eat healthy food, eat a good variety of them. Don't starve yourself, please. That doesn't lead to good endings. Also, we think about chronic infections. HIV infection is known to be a trigger for high reverse T3. Undiagnosed Lyme disease, undiagnosed hepatitis, these things can also cause high reverse T3 formation. Fatty liver syndrome, this is a really common one. Also in the new book, The Metabolism Reset Diet, I talked about how we've got a third or more of adults with really bad fatty liver syndrome, and probably another 80% that have it to some early degree. So that can be a driver as well. So it might be a matter of just losing some organ fat from inside the liver to help the body work better in that way. Diabetes can cause high reverse T3 formation, as can post-traumatic stress syndrome disorder. And depression can as well, major depression. So that's a great case in point about how powerful the mind is and how powerful our experiences and feelings are. So please know that these things affect a large number of people, and they can be drivers of high reverse T3 formation. Last one on this list would be chronic obstructive pulmonary disease. So how do you deal with this? How do you address this? Well, if you've been told you have high reverse T3, question one, are you taking thyroid medication? If you are, just take a peek at your TSH. Many in the alternative space rail against the TSH being meaningless. It's not meaningless. The ranges of it could be improved, but it's not meaningless. It's really the first indicator of your body's thyroid needs changing. Your T3 and T4, they are carefully regulated outside of your thyroid. They're not regulated from your thyroid. They're regulated also in circulation. Because of that, they will be buffered. And only when you've got a catastrophic excess of thyroid hormone will you see T3 and T4 elevate. That's the last thing to occur. Long before then, your TSH gets lower. And same thing on the other side. Only when you're totally out of thyroid hormone do T3 and T4 levels get low. Long before then, TSH creeps up. So it's the early warning indicator. So if you're on thyroid treatment and your TSH is less than 0.4 and you have high reverse T3, your thyroid medicine is the culprit. The one exception was thought to be if you're on T3 only medication, but now we know it can still happen in that case. And here's why. We form reverse T3 and we get rid of reverse T3. And so we can form too much or we can get rid of too little. And those on high dose T3 therapy, they can slow their breakdown of reverse T3 into T2. And so they're not making much, but what's there may not go away quickly or for quite some time. So any kind of thyroid overdose can lead to chronic elevated levels of reverse T3. That's the first thing to think about. If you are not on thyroid medication, or if you are and your TSH is greater than 0.4, there's either some other cause or it's just random. If your health is great, there's no chronic underlying issues, you're not having diabetes, cardiac risk factors, chronic symptoms, it may be meaningless and it's not really worth stressing yourself over past the sort of analysis you would get from a good physical and a full workup. If those things are clear, you're feeling great, take your reverse T3 level and just promptly ignore it. You can completely ignore it. There's no data saying it has any relevance to your health apart from those situations. There's a lot of data saying it's completely meaningless outside of those situations. And there's lots of data saying there's no agreed upon range. What one lab calls normal and another lab may call low, high, or also normal. So there's no consensus. Now, if you do have some ongoing symptoms, think about the points that I mentioned. Of current populations, I would think a lot about chronic dieting, protein calorie malnutrition, or carbohydrate calorie malnutrition as common causes. If those could be the case for you, please consider being on a less restrictive diet. Make any weight loss efforts distinct projects and do those in ways that would not be harmful for your liver and your thyroid. But that metabolism reset diet, I talked about that the best I could in thorough detail. If you've not been on a restrictive diet, if your weight's been going up, your diet's been pretty varied already, then we think about there being other metabolic factors. Consider your stress load, think about cortisol metabolism, think about any chronic depressive symptoms, infectious disease, major organ function, the fatty liver I mentioned, your kidney health, chronic infections. Those are the big drivers of that. And this is stuff to where the answer to how do you know which you have, the answer to that is naturopathic medical school plus residency and internship. Not a short answer, but get a doctor you trust and have them help sort out your cause. And please know that the solution is not to find the best pill to make you feel better in the moment. The solution is to find what's the real cause and how can we take care of that? And how can we take care of that through lifestyle? What do we do in terms of your mindset, what goes on between your ears, what goes in your mouth and how you move your feet? What are the things we can change there? They're going to help address those root causes and bring you back to lasting health. That's the ultimate answers. So don't think about just stimulants or pills. Just know that your body can heal itself. This is a normal thing, the high reverse T3. It's a normal consequence to too much thyroid, to chronic stressors in the body, or just a random change. But get a great doctor, help sort out which of those might be relevant for you, and know that you can move past that. All of our docs at Integrative Health would love to help you. We're available via telemedicine for distance care, if that's useful. And in the meantime, take great care, and let's help out and square away your reverse T3. And again, if you want to go really deep in this, I've got enough, you can read about this it's almost the length of War and Peace. It's much better reference, but you can go as deep as you want to find out more backup and more proof about these points that I made. Dr. C here, take great care. We'll talk real soon. Bye-bye.